Hey everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. My name's Dr. Jared Skowron, and I've been an autism biomedical doctor for 21 years, and here to help you guys with all of the different aspects of how you can help your child with autism. Now, our podcast focuses on the medical portion of autism because autism is a medical condition, and we have to treat it as such. So things like therapies are great to train your child to behave and act in a certain way and speak in a certain way. But what's more important is to make sure that we are fixing and correcting and balancing anything from a medical perspective or a biological perspective that's imbalanced. Because our major goal is to help our kids be independent. When they grow up, be independent kids, whether they're speaking, getting a job, getting married. We want to make sure that we help them with their life in every single way. So today's topic, we're going to be talking about probiotics. Now, 20 plus years ago when I was in med school, probiotics was snake oil. It was weird. It was something woo-woo, frou-frou, and kind of off the radar. Now, obviously, probiotics are a very mainstream type of thing, whether you're seeing commercials for yogurt or even when you're talking to your gastroenterologist, they may even suggest getting some probiotics. So how did probiotics kind of turn the tide from snake oil to pretty mainstream type of therapy over the past 20 years? And how can they help your child with autism, or will they help at all? So that's what we're going to be talking about today, probiotics. We're also going to intermingle a couple of other things, including prebiotics and fecal transplants. Okay, fecal transplant is when you put somebody else's poop inside your body. That's what a fecal transplant is. So let's get there. Before we start really diving into the science, because we always focus on scientific research in our podcast. Before we dive into the science, just want to say, for those of you who are new to Spectrum Awakening, we record our podcast live on our Facebook page every Thursday at 12:15 p.m. Eastern Standard Time. So I take my lunch break on Thursdays, pick a topic about autism, we get to talk, but you can also ask live questions. You can type live questions into the comments section and be part of our live recording. Obviously, you can watch this afterwards, whether it's in the podcast world or we put it on our YouTube channel or our Rumble channel. So we want to make sure we're getting all the correct scientific information to you. Okay, so let's start out before we get into our scientific research. Let's kind of, to getting my cheaters ready already, I want to kind of get into the basics of probiotics and prebiotics and fecal transplants and what those are. So what's important to understand is from a basic anatomy perspective, there are bacteria, there are viruses, there are yeasts that are part of our body, okay? They live on us. Period. They live on us, and we have this relationship with them where we are their host, and we help them by giving them a place to live, and we give them food, and they help us. They help us with our immune system. They help by digesting our food and converting some of our food to vitamins. So we've got this relationship with these organisms that we need each other. We need each other to be healthy, okay? And the term of the day of all of these organisms that are alive and are on us and within us are called the microbiome. Okay, biome kind of meaning the environment and micro being microscopic. All right. Now, what I want everybody to think about is how our body is shaped. Okay, our body is actually like a tube. Okay, it's actually a cylinder. So, and that cylinder is based around our gut. It's based around our GI tract, okay? Yes, I obviously have my skin, and my skin surrounds the outside of my body. And then beneath my skin, I have my muscles, I have my bones, I have my organs like my heart and my lungs and my stomach, my brain, etc. But our GI tract is actually the tube of that cylinder. It's that open space that does not connect to the inside of us. It is technically the outside of us. Because if I put let's take a piece of corn, all right? I eat corn on the cob, it's summertime. I eat some corn on the cob, it goes into my mouth. I chew it, it goes down my esophagus, it hits my stomach, it goes into my intestines, and then it comes out in the toilet looking pretty much the same as a piece of corn, okay? So our whole GI tract is the outside world from an anatomical perspective. It is not inside our body. Yes, It's inside that tube. Again, take a look at like, a paper towel roll or something, okay? Yeah, it's in there, but it's not actually getting inside of us. It's not contacting our muscles or our bones or our bloodstream. Our gut is very similar to our skin. It's a barrier between the outside world and the inside world. So we just kind of put food in there and our body decides what it's going to absorb and what it's not going to absorb, okay? Now, in that tube, it's dark, it's moist, it's humid, and doesn't really have much oxygen. So what lives there are all of these different microbes, all of these different microscopic organisms that frankly don't need oxygen to breathe. So we have different bacteria, we have different viruses, we have different yeasts, we have different other different organisms that are going to live on our skin. Those are the ones that breathe oxygen. And ones that don't need oxygen, those are inside our intestines. Now, we do have some organisms kind of near the exit site, near our anus and our colon. Those tend to breathe oxygen because there's more oxygen in there because of the exposure, but you get the idea. We have all of these organisms that are living on the outside surface of us, whether it's the outside surface of our skin, in our mouth, in our esophagus, gut, intestines, stomach, that are there, and they help us, okay? So they're called the microbiome, and we're also going to call those organisms probiotics, okay? The word pro is, meaning good. So the probiotics are these organisms that actually are beneficial for us. Again, they help us digest our food. They help protect us as they are part of the immune system because they want us to be alive. They want to defend us so they have a place to live and they get free food. We put food in our mouth and they get to eat it. They're like, thank you for the free food. All I have to do is sit here. All right. So that's what these organisms do. So that's the term probiotics. That's the term microbiome. Now let's get into the term prebiotics. Prebiotics are actually the food that the probiotics eat. So honestly, any food you put in your mouth is a prebiotic. It's the food that these organisms, these probiotics, are going to eat. Okay? So that's what a prebiotic is. We'll just quickly talk about fecal transplant. Fecal transplant is a therapy where you take somebody else's poop that has these organisms, and frankly, hopefully the good ones, and you put that into your gut. You put that into your intestines. You can do that. They actually have pills of fecal transplant, pills of poop, okay, poop pills. You take those and they get down there. Sometimes you can insert it rectally, whether that's with an enema or a suppository or some other kind of delivery device where you're putting somebody else's poop into your colon. And fecal transplants are really an advanced up and coming type of therapy to treat severe intestinal disease. So people with Crohn's, people with ulcerative colitis, people with inflammatory bowel disease are actually getting permanent cures with fecal transplants. And it's really an interesting thought process that if I can take healthy poop, and poop is about 50% probiotics, okay? Poop is 50% your food, 50% the bugs. So if I take a lot of good bugs and insert it in there, okay, that's going to change my microbiome. That's going to change who's living there and can actually heal inflammatory disease. And so that's a really big concept I want you guys to think about, that whatever bugs are living there, whatever our microbiome consists of, whatever our probiotics are there, are going to have an effect on our immune system and on inflammation. Okay, so let's then kind of talk about which bugs are there. All right. And this is a really important question because the answer to this question determines our treatment. Okay. Which bugs are there? Which bacteria are there? Which viruses are there? Which fungal organisms are there? That is going to change on a day-to-day basis. Okay. And it's going to change based on the environment. And the metaphor I'm going to use are snowbirds. Okay, so I live in the northeast of the U.S. and it gets cold in the winter and there's a lot of snow and there's a lot of ice. So a lot of the older population, a lot of the retirees go down to Florida. They go down south. They go to Myrtle Beach. They go to Arizona. They go to Florida in the winter because they don't want to be around the cold weather. They don't want to be around the snow and the ice. And when they're down in Florida and Arizona and Myrtle Beach, when it gets hot and humid, they don't want to be there either. So they come back up north in the summer, here in the northeastern part of the country, because they prefer that environment, okay? So we as humans are going to move to the environment that we prefer, all right? And it's a great metaphor because other microscopic organisms do the same, all right? Bacteria, yeast, viruses, they're going to go to the place where they're enjoying that environment, all right? Now, what type of environment are we talking about? It's really two things. Number one, it's pH. It's acidity level. What acidity level is beneficial for that organism? That's the one that they're going to flock to, okay? If an organism doesn't like that acidity level, they're going to leave, okay? They're going to take the fast-tracked, easy-pass exit to the toilet and get out of there, all right? So pH is one thing. The other thing is the food, all right? Are you floating down the food onto my face that I want, that I consume? Okay, and what seems to happen, and this was a research study done by Dr. Timothy Bowie, genius gastroenterologist in Boston, shows that the more sugar you eat, okay, the more simple carbs, the more breads, the more pastas, those kind of things, inflammatory organisms feed off of those. Okay, so bugs that are bad for us are going to want sugar. So the more sugar we eat, the more the bad bugs are there. They're like, hey, this is great. This is exactly what I'm feeding off of. It's time to party and cause some inflammation with all this sugar. All right. The more fiber we eat, the more complex carbohydrates, the more whole grains, the more fruits, the more vegetables. The party organisms don't like that. Okay. It's the studious, beneficial ones. Those organisms thrive better on that type of food and that type of diet. Okay. So the environment of those organisms are based on the pH, the acidity, and based on the foods we feed them. So a lot of people, not just kids with autism, a lot of people are going to have good microbiome, good probiotics, or bad microbiome, bad probiotics, just based on the foods that we eat or the acidity of our gut. So this then rolls into treatment. Treatment of, hey, if I want the most healthy, the most beneficial bugs in my gut, how do I do that? All right. And we really have three options. Option number one, which is super common, are probiotic supplements. I can put the good bacteria in my mouth, send it down to my intestines. Okay. That's option one. You can do that in the form of probiotic supplements. You can do that in the form of fermented foods like yogurt. That's choice number one. Choice number two, fecal transplant. Now, fecal transplant is uncommon. I think it's very effective, but it's uncommon. It's not easy to do. It's got that gross factor to it, but it's an option. And then option number three is changing the foods you eat. If I change the foods I eat, it will change my microbiome. It will change my probiotics. We used to do this, when I was in med school, we would actually treat vaginal infections. So women who had vaginal yeast infections or women who had bacterial infections, bacterial vaginosis, we didn't need to give antibiotics or antifungals. We would actually give different vaginal suppositories that were acidic or basic to alter the pH. And when we altered the pH, the infection left because the infection wasn't comfortable there. It didn't want to be there. So we didn't even need, our society is so focused on killing bugs. But we can just make it uncomfortable and tell them to leave, okay? Hey, you've got people over your house you don't want? I'm going to crank up the heat. Yeah, they don't like it hot and they get out of there, okay? Very simple to do when you're consistent about it. So there you go. Those are our three options. Probiotic supplements, fecal transplants, uncommon, tough to get, but an option, or changing the foods and the acidity. That's how we can do that, all right? So how does that affect autism? And what does the scientific research say? Because I know probiotic supplements are extremely popular. One of, if not the most popular categories of vitamin supplements or natural supplements on the market are probiotics. And I believe they are because they can be so beneficial. All right. And I'm going to emphasize that can. I think probiotic supplements can be extremely beneficial for people who need them. And for people who don't need them, they're not beneficial because if you've already got the good guys there, adding more good guys isn't going to do you more better. It's just kind of keep you where you are. So let's take all that and bring it into the scientific research on scientific research studies done with probiotics, prebiotics, fecal transplants, and autism. All right. Cheaters on, everyone. And we've got our first research study. And this first research study is Probiotics in Autism. This was just published in 2024. Numerous pharmacological interventions have been developed for autism, often proving ineffective and accompanied by a multitude of side effects. The gut microbiota is the reservoir of bacteria inhabiting our gastrointestinal tract. The gut microbial alterations observed with autism include elevated levels of Bacteroidetes, Firmicutes, and Proteobacteria, as well as reduced levels of bifidobacteria. Preclinical studies have shown favorable outcomes with probiotic therapy, including improvements in oxidative stress, anti-inflammatory effects, regulation of neurotransmitters, and restoration of microbiome balance. Okay, so that's a pretty good research study, all right? And that basically says, kids with autism have imbalanced microbiome, imbalanced probiotics. They got more of these guys, which they listed, these fancy Latin and Greek terms, and fewer of these guys, the bifidobacteria. We're going to get to that one again, which is why I name it. And giving probiotics can help in those myriad of ways. So, seemingly, probiotics based on this study can be beneficial, okay? Next, a systematic review of the effects of probiotics with autism. Although fecal transplants have shown positive outcomes in treating dysbiosis and symptoms of autism, lifestyle modifications such as dietary interventions will prevent and treat this disorder without causing major adverse effects. Probiotics enhance the microbiome, which help in gut permeability, cognitive function, and immunity. Children with increased GI symptoms have also shown increased behavioral disturbances. Okay? And I wanted to focus on this because, on this study, because of what it says at the end. Increased GI symptoms show increased behavioral disturbances. I'm actually giving one of my lectures at the TACA Autism Conference this October about this, about kids who have behavior, whether you're hyperactive, whether you're angry, whether you're violent. I saw a patient today, because I have a telemedicine practice. I saw a patient today who's on risperidol and guanfacine. Two major psychiatric sedatives, and they're still bouncing around and super anxious. Okay? Many autism behavioral issues are due to GI symptoms. That can be an infection, that can be dysbiosis, that can just be general pain from poor digestion. But GI symptoms correlate with autistic behaviors, all right? A lot. So if you got a kid with behaviors, I want you to think about stool testing, I want you to think about gut treatments, and we'll get to it. Okay, next. Here is a single study of the effects of probiotics in the treatment of children with autism. At 3 months after intervention, both groups had a significant reduction in their ATEC score. Okay? Very simple and straightforward, but exactly what we want to know. Okay? If you're not familiar with the ATEC is an acronym, ATEC, the Autism Treatment Evaluation Checklist. It's basically a parent survey that lets you evaluate different treatments before and after. So this research study gave probiotics to kids, and after 3 months, did ATECs, and the ATECs was lower. It was better on the kids who got probiotics. That's pretty great. That's some good stuff. Okay, here's another one. The probiotics in the treatment of autism. Probiotic administration to regulate the gut-brain axis might improve gastrointestinal symptoms, restore autism-related behavioral symptoms, and restore microbiota composition, reduce inflammation, and restore intestinal barrier function. I like this study because it gets into the details of how good bacteria, good microbiome, good probiotics are helping, because probiotic administration improves GI symptoms, improves autism behaviors because you're helping with the gut symptoms, restores the gut microbiome, reduces inflammation, and restores intestinal barrier function. That's fancy words for leaky gut, okay? What's leaky gut? So again, look at our skin. Okay, nothing's getting in there unless I have a cut. Or maybe I'm inflamed, or maybe I have eczema, and it's raw, and things can get in there, okay? Same with our intestines, all right? Our intestines are nice, and they're closed. Nothing should be getting in there but what the body wants. But when there's inflammation, it starts to open up a bit. They call that leaky gut, or they call that poor intestinal barrier function. Probiotics can help that by reducing inflammation. All right, good research study. Now, I'm kind of going from there to the different meta-analysis studies. So the meta-analysis studies are researchers who don't do research. They look at everybody else's research and kind of put it all together and say, hey, this is what everybody says together as a group. Okay? So here's a couple meta-analysis. This is from 2022, Probiotics for Children with Autism. No consistent outcomes in studies on the use of probiotics in children with autism. So basically what this says is that, when you look at all the research together, it doesn't really say they're good. It doesn't really say they're bad. It kind of says nothing. So that grouping of studies says, nothing that we noticed. All right. Here's another meta-analysis from 2021. Probiotics, prebiotics, and fecal transplant in the treatment of behavioral symptoms of autism. Results of probiotic studies do not confirm the supposed beneficial effect of probiotics on autism, whereas prebiotics appear to be efficacious in selective behavioral symptoms. There is a link between altered gut bacteria and autism spectrum disorder. Some people believe that modulating bacterial composition in the gut may help reduce autism symptoms. But evidence from human studies suggesting beneficial effects of probiotics, prebiotics, and combinations, as well as fecal transplants in autism, is limited and inconclusive. Again, another study that's not research in and of itself, but putting everything together that says probiotics don't seem to do much, but prebiotics do help with the behaviors. Okay, we'll get into that. We'll wrap up and kind of put this all together in a little bit. All right, here's a nice study. Here's a fecal transplant study. Long-term benefit of microbiota transfer therapy on autism, fecal microbiotic transplant, that's fecal transplants, significant improvements in GI symptoms. We report on a follow-up study 2 years after the fecal transplant. Most improvements in the GI symptoms were maintained, and autism-related symptoms improved even more after the end of treatment. So this is a nice study saying we did a fecal transplant, we saw benefits, we contacted those people 2 years later, they maintained their benefits or had more. Pretty cool. All right. Last but not least, and then we're going to do a little wrap up and then get into some other stuff. Here's a research study on whole fruit and fruit fiber. Less than 10% of most Western populations consume adequate levels of whole fruit and dietary fiber, with typical intake being about half of the recommended levels. Evidence of the beneficial health effects regarding their prebiotic effects. Potential health benefits include protecting colonic gastrointestinal health, e.g. constipation, irritable bowel syndrome, inflammatory bowel diseases, and helping to attenuate autism spectrum disorder severity. All right? Pretty interesting stuff. We're not talking about giving probiotics. We're not talking about giving a prebiotic supplement. We're not talking about sticking somebody else's poop up your butt. We're talking about eating fruit, period. How does eating fruit and the fiber in fruit improve GI health, improve your constipation, and improve your autism severity? All right? This leads into a little bit of a summary. Still got a couple other things to go over. A little bit of a summary. Let's put all this research together, okay? Let's put all this research together and what does it really mean? Because we have some research studies that say, hey, you know what? Probiotics are good for autism. They're going to help my behavior. That's great, okay? We have some studies that say, you know what? We don't see it. We put all this research together and we really don't see the benefit of probiotics. Other research studies say the same about prebiotics, which is basically healthy fiber. You know what? Hey, we gave this healthy fiber, we saw benefits. We gave the fecal transplant, we saw benefits. What does this all mean in totality? And what does it mean for you and your child? Okay? Let me say this. The basic answer is that autism is a spectrum. Not one single kid is the same as the other, just like us. We're all individual little special snowflakes, okay? And we're all different. What also is different is our microbiome. The bugs in our gut are going to be different for each and every one of us. They're going to be different day to day, okay? They're going to be different day to day based on what we eat, okay? So I really want to hammer home that our microbiome, those bacteria in our gut, affect the inflammation, they affect our digestion, they affect our gut health. Our gut health is completely related to our behaviors. So if we have a lot of inflammation in our gut, it's going to hurt. There's going to be pain, and we're going to have bad behaviors. So when we see kids with behaviors that we don't like, often that's due to gut pain or gut inflammation. Often, okay? That is hugely influenced by the bugs that are in there. Okay? Those bugs that are in there are there because of what we eat. Period. Okay? They're also affected by antibiotics. They're also affected by chlorinated water. You know, we put chlorine in water. We put chlorine in our pools to kill off bacteria so we don't get infections. We don't get E. coli. But you're going to drink that chlorinated water from the pool or from your tap if you have city water and you don't filter it, and that chlorine's going to start killing off the bugs in your gut. That's why the chlorine's there. All right? You take antibiotics, that's going to kill off your bugs as well. So many different things affect what bugs are growing in there. And again, it changes on a day-to-day basis based on what we put in there. Are we putting things in there like chlorine or antibiotics that kill the bugs? Or are we putting in sugar that's going to allow the bad bugs to stay there and create inflammation? Or do we eat a lot of fiber and whole grains that keep the good bugs there? And this is kind of the big picture of lifestyle that I think drives the research. That there are people with poor microbiomes, okay? Whether it's bad eating, whether it's a lot of antibiotics, you got bugs in there that don't help you. They cause inflammation, they cause behavioral issues. Probiotics work for those, okay? For those people who have bad microbiomes and bad bugs, or killed them off with a lot of antibiotics, or whatever, life happens, okay? People with that status have great responses to probiotic supplements. Fantastic. Have great responses to prebiotics and great responses to fecal transplant. All right? If you have a good microbiome, if you don't eat a lot of sugar and the good bugs are there, then taking probiotic supplements probably won't do much for you. Because, hey, I've got more of the same thing that's there. It's really not going to do much. All right? So I really think the whole probiotic question is a person-by-person answer. If you've got bad bugs, probiotics are going to do great. All right? If you got good bugs, probiotic supplements aren't going to do much. So what do we do from here? What do you do with your child from here? Number one, most important, if you want to help with gut health, it's fiber. Period. Complex carbs and fiber are the prebiotics that are going to keep the good bugs there. And the bad bugs don't want fiber. The bad party animals don't want healthy food. They want to booze it up, so they leave. All right? Fiber is the way to go. Now, obviously our kids are picky eaters. They may not want to eat 4 servings of fruits and vegetables a day. So for those kids, a fiber supplement is huge. If you were to choose probiotics or prebiotics, I would go with the prebiotics. I would go with the fiber. Okay? There's a lot of fiber supplements out on the market. We've got a great one here. It's called Brown Log Fiber. All right, this is a prebiotic. And it tastes decent, honestly. It's got a lot of great fibers like rice bran and beetroot and psyllium and apple and ginger and peppermint. It does not have inulin. I know a lot of people have tried inulin as a prebiotic and got a lot of gut issues. And the reason is because when the bad guys leave, it hurts. Okay? So when you take inulin and your kid has behavioral issues, it's because it's painful. All right? But this is a brown fiber, all right? And it tastes, put a little on my finger there. It kind of tastes like apple fiber. It's a pretty bland taste, which is nice for our kids, okay? So if you're going to start anywhere, prebiotics, I think, is the way to go. And it's something we need to do on a daily basis. We need to eat on a regular basis all these grains, okay? Do you want to give your child a probiotic? Okay, that's the question. I think there's 2 answers. Answer number 1, try a good probiotic and find out. Okay? Trial and error. Try a good quality probiotic. If it helps, great. Do it. If you don't see a benefit after 1 bottle of a probiotic, you're probably not going to get any benefits from it. And then switch to the prebiotic. So that's option 1. Option 1 is trial and error. And we've got a great probiotic. Again, I try to make everything that we have the best quality. Everything's gluten-free, dairy-free. We have a probiotic. It's called Gut Reset. All right. Here's the ingredient list on it. It's got 40 billion CFUs, 20 billion lactobacillus. We have 5 different strains, and 20 billion bifidobacters, 4 different strains. All right. No inulin in this either. So this is a great quality probiotic that we've got. There's a lot of great probiotics on the market. Our probiotic does not have strep strains. Some probiotics have strep. That can exacerbate some of our kids with pandas. So that's why our formula doesn't have it. All right. But do you want that? Is it going to help? Again, option 1 is trial and error. Try a bottle, see if it works. If it does, great. If it doesn't, I don't think more is going to do anything. The other choice is to perform a stool test. Okay. an advanced stool test, not a regular stool test you get from your conventional doctor, but a really high-grade stool test will test your microbiome. It will test your probiotics. And that'll give you an idea of whether you should probably take it or not. Okay? Here's an example of, this is the Genova stool test. On our website, we offer the Genova stool test, the Mosaic Diagnostics / Great Plains stool test, and the GI map. So we have all of those on our website. If you want to get a high-quality stool test, go to our website, use our coupon of the week, get the stool test. I get the results, I interpret the results, and then I send you a copy of your results and my written interpretation. Okay. Here's the page that you'll get. These are the good bacteria. These are your probiotics. This is your microbiome, okay? And here's lactobacillus, and here's bifidobacter. Those are the ones that were in our gut reset probiotic, all right? So for this patient, lactobacillus levels right there, a little low, probably want some. This patient's bifidobacteria, little low. This person would probably benefit from a probiotic. The other thing I want to show you is all these other good bacteria, all these other probiotics, okay? You're not going to get in a supplement. You're not going to find a probiotic supplement that has all the rest of these, because all the rest of these are anaerobic. They don't breathe oxygen. You put them in a pill, they're going to die. So probiotic supplementation is limited because you can only put in there organisms that breathe oxygen, like the lactobacillus and the bifidobacter. Super important, but not the only ones. And so my message from there is, how do I fix all these other guys? Prebiotics, fiber, the good food that they want to eat to be there. All right? So again, and I hammer this home because I know probiotic supplements are super common. They've gained so much popularity. They help a lot of people. That's why they're so popular. But they don't help everybody. And what else can we do to enhance that? It's to give the food. It's to create the environment that they want. Where do the good bugs live? That's where they live. Okay? So pretty interesting stuff. Let me give you guys the coupon of the weekend, little summary, and then we'll answer our live questions. All right. Coupon of the weekend is Probiotic 20. Probiotic 20 is going to get you 20% off any of our supplements, any of our lab tests, like the stool test, but all of them, from SpectrumAwakening.com. That expires July 28th, 2024. If you want one-on-one help, if you want a telemedicine appointment with me, go to our website, click the appointment tab. You can set up an appointment with me. We talk on the phone, on the computer. I have patients around the world. I mean, just this morning, again, I'm in northeastern U.S. I'm in Connecticut. Talked to somebody from Tennessee. I talked to somebody from Texas. I talked to somebody from Pakistan. People all over the world have kids who need help. And man, I'm here to help you guys. That's why I do what we do. All right. Let's throw down another summary real quick because I think I just kind of did it. And then we'll answer our live questions. Microscopic bugs are a part of us. What I didn't mention before, and I'll mention now, there are 10 times the number of living organisms on our skin and in our gut than cells of our body. There are 10 times more of them than cells of us. All right? We are symbiotic. We work with each other. We provide a home and transport and food for them, and they help us with immune defense and with digestion and with absorption of nutrients. So we need each other. All right? What bugs live in your gut is based on what food there is, because they're going to live in the environment that they prefer. Okay? Just like us as humans try to go to the hot or the cold or the temperate areas that we like, so do these bugs. And the environment for them is acidity and diet and food. Okay? How many thousands and thousands of years have we evolutionarily developed by eating fiber and whole grains and, the grasses in the fields? I mean, that's what we ate. We didn't have sugar. We didn't have simple carbs. We didn't have pasta. So we've developed, and these organisms have developed for us to be healthy by eating that kind of food. All right. Fast forward to the past 100 years where sugar is everywhere and plentiful. And now we're all getting these chronic diseases and illnesses. Okay. Because that bad food feeds the bad bugs. So the more sugar we eat, the more simple carbs, the more pasta, the more breads we eat, the more bad bugs. The more fiber we eat. Okay, prebiotics are just the food for these probiotic guys. The more fiber we eat, the more fruit we eat, the more whole grains we eat, the more beneficial bugs will live there. Period. Okay, so you can give a prebiotic supplement like our brown log fiber. You can give a probiotic supplement like our gut reset. You can get a stool test to see if you need probiotics or prebiotics. All right. You can also get a fecal transplant where you take somebody else's poop, hopefully somebody healthy with the right bugs, put it into your gut, and that can massively reduce gut inflammation. Primarily used right now for inflammatory bowel disease like Crohn's and ulcerative colitis, but there is inspiring research on how it can help autism as well. All right. So I think my main point is if you've got a child with behavioral issues, it's probably gut problems. Okay. Could be an infection, could be inflammation, whatever. Could be bad digestion. Try more fruit, try more whole fiber. If your kid's a picky eater and not going to do that, get on a prebiotic supplement like our brown log fiber. If you want to try a probiotic, try a probiotic. Okay. Our gut reset is a great probiotic. There are other great probiotics out there on the market. Try one and see what happens. They've become so popular over the past 2 decades because they've helped so many people. Not going to help everybody, but worth a try. Or get a stool test. You get a stool test and you'll know definitively, here's my microbiome. But again, that microbiome changes day to day based on what you eat. So, a lot of maybes here are the answers to the questions, do I need probiotics? But the potential is there to help. The potential is there, might help your child, and it's definitely worth a try. All right, let's get into the live questions. Live questions. Live shout out to Dolly, who's always here, and Molly and Jeannie. Molly, so hard to find a probiotic my son will take because he can't swallow pills and won't do anything powdered. Yeah, I mean, Molly, what you can do, take the capsule, open it, get an ice cube tray, or get a syringe. So this is a question I get a lot. How do I give my kids this stuff? Well, if you can take powders and mix it into juice or something they like to drink, put it in a syringe, squirt it in their mouth, give them a prize, and hopefully they'll get the idea. You can also get an ice cube tray, make Jello shots. Hey, mix probiotic in each Jello shot of the ice cube tray, or maybe make some juice popsicles and mix your supplements in those so they're dosed out. Kay's watching. Kay's always on. Jasmine, hope Charlie's doing well. Good morning. Is it normal to pass parasites on the yeast mold bundle? Yeah, you can. For sure. Charlie has been, and it's disgusting. And it's awesome. So Jasmine, Charlie's patient of ours, is taking our yeast mold bundle, which is extremely popular, and noticing passing parasites and some disgusting stuff, which is great, because guess where we want it? We want it out of here. Out of here. I hope you notice some great changes after we get rid of that stuff. Let's see. We've also got Gata. Doctor, ask your advice about sound frequency. Does it help autism disorders? Gata, that's a really interesting question. She asks if sound frequency therapies can help. I don't know. I haven't had any patients do it, but I've read some interesting research, and I am intrigued on vibrational therapies for a multitude of health issues. In fact, because of the super nerd I am, I've got a research study sitting on the back of my toilet at home about sound therapy and different medical issues. So working on reading it, but I do think it's quite intriguing. Even if it's just to remove parasites and infections, okay? Going back to the 20th century, if you ever watched that movie, that Kevin Bacon movie, Tremors, where they had to fight the parasites that were underground where they lived, they did it by pounding the ground and sending sound vibrations into the ground, which brought the parasites out, and they were able to eradicate them. Obviously, it's a movie, but if you look at ancient deworming and deparasite ceremonies, like ayahuasca, one of the key components, there's 2 key components. There's a herbal tincture that is a concoction of different herbs that are deworming and kill parasites, but also part of the ceremony is music. And that music and that sound vibration, I do believe, shakes these guys out of our cells so that they can be exposed to the medication. So it's intriguing stuff, Gata. I think it's intriguing stuff. Gata, how can we get a transplant fecal matter in the intestine of an autistic kid? Well, first off, you got to find the good poop. Okay, where are you going to find the good poop? Right now, the only legal way is with a gastroenterologist. So I would Google gastroenterologist fecal transplant in my area and find out who's doing it in your hospital. Give them a call, see if they would consider it. Okay. If not, then there is a brown market for this stuff, not a black market, a brown market, where you can buy baby poop and put it in an enema bag and stick the enema, up your kid's butt and put it in there. Easier said than done, but those are our options. Sharon, how do we know if the child has cortisol issues? You have to test your cortisol, which is a simple urine test through your local lab. My child's overactive in the morning and always impulsive, finds hard waiting for turns. Cortisol testing, simple urine test. You can do it through your local lab, your local hospital, Quest, LabCorp, you name it. Jeannie, so our gluten-free pastas that we eat are just as bad for inflammation? It depends on the fiber. It depends on what they're made of. I think if you get like lentil pasta, then it's more of a complex carb. I get mine from Costco, kind of like it. I think if you're just getting another grain, like a rice pasta, it's still a simple carb. So I would see if you can find a pasta that's more whole grain, like a lentil or a bean pasta versus a rice pasta. Sharon, stool test shows no growth of enterococcus. How do I add it? Prebiotics. There's going to be no probiotic enterococcus. Okay, just give the food, give the prebiotics, and let it happen. Selma, I'd love to change my son's diet, but his diet's already so limited. That's the problem. We got to fix the sensory issues first. So I believe probiotics are our only option as of now. That's okay. Which ones do you suggest? I suggest the one that I formulated, Gut Reset. I know it's high quality. I know it's worth a try. Again, different probiotics have different strains. Different ones work for different kids, so there is some trial and error. But I would try ours. Obviously, any Spectrum Awakening supplement comes with a 30-day money-back return. Your kid doesn't like it, you don't see what you want, send it back for a refund. Spectrum Awakening would rather you try something and send it back for a refund within the 30 days than try nothing. Okay? And let me also say this as a side comment. I don't know if there's going to be a question on it. You will see research studies that say this probiotic helps autism. This is the one. Here's the research study. Frankly, I think that's a lot of marketing. I think whoever's making those probiotics funds the study and says, look, ours has a research study. I think it's probiotics in general that are going to help. I don't think there's one better than another. And again, if you take that probiotic but eat a crappy diet, it's going to leave. It's not going to stay there. Unless you do the fecal transplant. Fecal transplant seems to stick. Molly sharing. Thank you, Molly. We got to get this info out to everybody. Rahila, whenever you have time, please advise where we can get a fecal transplant done. Again, it's your local gastroenterologist or doing it yourself on the sly. Brianna, have you seen the Netflix documentary Hack Your Health? I haven't, but now I know what I'm watching tonight. Been busy watching the new Ghostbusters movie that just came out. Brianna, do you have any experience with Kelly Dorfman protocol for apraxia? I have some patients that have been on it. Some benefited, some didn't. Again, like with anything with the spectrum. So, I think it's like anything with the spectrum. You pick a horse to ride, you try it for a little bit. If it works, you keep it. If it doesn't work, you don't. Okay? With whatever you're doing. Whether it's that protocol, whether it's another protocol, whether it's our supplements. Try something, give it a couple months. If it works, keep doing it. If it doesn't work, do something different. Okay? Got it. My autistic child has nausea and vomiting more frequently. Why? Well, if you're taking mineral supplements, minerals often cause a lot of nausea and vomiting. But if it's just random nausea and vomiting, you want to check for stomach infections. Do they have an ulcer? Do they have H. pylori? Or do they have mitochondrial issues? Because, nausea and vomiting are a really common mitochondrial symptom. You may want to try our mitochondrial supplement, Mitomax. Sherry, probiotics versus prebiotics. I hope I've explained that. Amanda, is there a specific probiotic that you recommend? Our son's been on a probiotic for quite a while. Just wondering if there's a specific brand. Again, like I mentioned, I like what I formulated. Another thing to look at when you're looking at probiotics in general, you want to look at number of strains and dose. All right, so let me pull up mine again as an example. Okay. We've got 9 different strains. We have 5 different lactobacillus strains. We have 4 different bifidobacter strains. Okay, that's good. That's a good, comprehensive shotgun approach to probiotics, which is what you want. If you've got something like Culturelle, Culturelle was the first probiotic that really became popular on the market. It's one strain. Okay? You want more broad spectrum. You want multiple strains. So that's one thing you're looking for. Or like Floristore. Okay, really popular, been around for a long time. One strain. Unless they've changed it and I don't know. The other thing is dose, okay? We got 20 billion, all right? So that's what you're looking for is dose. So probiotics are given in CFU. They're not given in milligrams. You're not going to take a milligram of a probiotic. You're going to take a CFU of a probiotic. So something like 20 billion is a good dose, all right? Again, going back to Culturelle, because it's the first on the market, it's 1 billion, not 20 billion, it's 1 billion. So think about how big your gut is. Think about how long your intestine is. And if you stretched it open, I think it's like the size of half a tennis court or something. All right. We have so much surface area in our gut. And, I think about probiotics. I'm like, think about throwing a probiotic capsule on a tennis court. Blink, blink. All right? It's not a lot. It's not a lot. So dose matters. Dose matters. All right. Got it. Probiotic need high acidic or low acidity? It depends on your acidity. But again, just going back to the metaphor that I used, throwing a pill on a tennis court, you're not going to really change the acidity much with that. You're going to change the acidity with what you're eating and drinking. Period. All right, Miranda. Not topic related, but may I ask, what are your thoughts on chelation for lead? Remove covered all exposed areas, daughter's lead levels still in the low 20s. If not chelation, any other advice to get the lead out? Get the lead out. All right, Miranda, you bring up a good topic. How do I remove heavy metals, specifically lead? Luckily, lead is easily removed from the body. Very easily removed. The best thing we used to use, but it's now been converted to a medication, it's not over the counter anymore because it works so well, is something called DMSA. Okay, DMSA was used since the 40s to treat lead poisoning. I mean, all the Navy sailors who got lead poisoning on the Navy ships, because we used lead paint back then, got DMSA, the lead's gone in weeks. It's weeks. It's extremely effective. Again, used to be over the counter. Now it's registered as a medication because it's so effective. But right now, I would use ALA. I would use alpha lipoic acid. We've got an alpha lipoic acid supplement. It's going to be great. It's going to get the lead out really quickly. If your child has lead still, there still is a source. Find that source. I'll give you an example. I had a kid, level was in the 40s. Okay? They checked their house, didn't check the paint because they had an old house. They didn't find any. Months and months, the Department of Public Health is there. They're trying to find it. They can't find it. Where they didn't test was the ceiling. Okay, they didn't test the paint of the ceiling in their kid's bedroom. That had lead paint, and the lead was just floating down every day. Okay, so you may still have lead somewhere. I would look for it. But try our ALA, or alpha lipoic acid. Jasmine, how do you suggest a detox from swimming and chlorine? Great question. Okay, how do we get that chlorine out? Iodine. Just make sure when the salt in your house, Jasmine, is iodized salt. Okay, and I say this to everybody. Whatever salt you use, I don't care if you use regular table salt or you use sea salts or whatever, make sure there's iodine in it. By law, it has to say on the label whether it contains iodine. Okay? Get salt with iodine. Iodine will get rid of your extra chlorine. Period. Okay? It'll get rid of your extra fluoride. Okay? Fluoride in the drinking water, fluoride from the dentist, it causes intellectual disability. Okay? It lowers IQ. Fluoride lowers IQ. There's plenty of research. All right? Iodine. Just use iodized salt. Easy, simple, Maybelline. All right, what else? Asha, how about enzymes in relation to probiotics and prebiotics? Good question. We didn't talk about it, but digestive enzymes are the substance that digests your food. It breaks food down into tiny parts. We make digestive enzymes in our pancreas, in our intestines. Okay, our liver, our stomach make different things that digest food so we can absorb the nutrients and calories. Some people who are in overstressed sympathetic response have poor digestive ability. We actually test this on our stool tests. Whether you use an advanced stool test or a typical lab, you can order analysis of digestion. So if it's low, that often comes with inflammation. Okay, inflammation is going to shut down your GI tract. So kids who have really bad constipation, kids who have poor motility, they're probably going to have poor digestion. And taking digestive enzymes with each meal can be hugely helpful. All right. That also does affect your microbiome a little bit. So it's good to have the right enzymes, whether you're taking them or whether you're making them. Dolly, how would the good bugs that are low or non-existent raise from prebiotics? Great question. I kind of skipped that step, Dolly. I didn't tell you that. Look, anytime you open your mouth, you're exposed to all of these organisms. They're everywhere. They're on our skin. Okay, they're on things I'm touching. They're in the air. They're everywhere. It grosses us out because we normally don't think about them, but they're everywhere. These microorganisms are everywhere. Okay, so as soon as you open your mouth, that stuff's going to get in there. You just got to make sure you're feeding it the right food, and then it'll stay there. Amanda, can you take a probiotic and a prebiotic? Yes. And frankly, you do every day with the food you eat. All right, you eat food. It's a prebiotic, whether a good or a bad one. All that food's got some kind of bacteria on it, period. Hopefully nothing that's going to make you sick. So you do every day in low levels, so you can take probiotic and prebiotic supplements every day. Ruby, does zinc help with picky eating? A little bit. I think it's more inflammation that's dealing with the sensory issues. A little bit. Susan, thanks again, Dr. Skowron. Appreciate it. Anytime, Susan. I'll educate. You spread the word. Kathy, do you provide a suggested diet for our autism kids? Well, Kath, I would go back in our podcast. We've got diet podcasts back there. And I think the general answer is the same, which is everybody's different. Okay? Some people do just fine on certain inflammatory foods and some people don't. Some people do okay with dairy and some people don't. And some people do okay with gluten and some people don't. And then there's other random foods. You know, if my wife eats an eggplant, her knee swells up with arthritis so much she can't walk the next day. Eggplant. Okay? So obviously gluten-free, dairy-free, and other kind of diets are extremely popular with autism because those foods are often inflammatory with many people. So it's a good shotgun approach to try to say, you know what? If dairy is a problem for 70% of the world and gluten's a problem for 70% of the world, I got 70% odds this diet's going to help my kids. Okay? So is it going to help everybody? No. Will it help many? Yeah, sure will. Okay? I would definitely say for everybody, more fiber. Okay? We lack fiber, more fiber. Okay? And eliminate artificial colors and dyes. That's not food. Those are chemicals. They're outlawed in Europe, but we have them here in the U.S. So everything's pretty and colorful. All right? Get rid of the artificial colors and dyes. They're proven to cause ADD. More fiber. And if you can, obviously fruits and vegetables and healthy foods. And if you can get things like garlic and onions and spices like oregano and thyme in there, that would help too. Easier said than done, I get. Brianna, do you carry a vitamin E or a choline supplement? We've got vitamin E in our Panda Bear supplement, not a standalone, but I'm thinking of adding it. And choline we have as alpha phosphorocholine. Hold on, let me turn my neck here. We've got, oh dear Barbara, this is our superflinic acid supplement. We have alpha glycerylphosphorocholine, alpha GPC, in our folinic acid and in our Power and Focus, not as a separate. But I am thinking of adding a vitamin E as a mixed tocopherol, because you don't just want alpha tocopherol, you want beta and gamma. Jasmine, to answer your question, yes, we've seen a lot of parasites pass since he's passed we've seen a lot of positives since he passed the parasites. Pickle peppers. More words. Okay. Oh, I love the new emoji. Look at that. So Charlie's a patient of ours, and the yeast mold bundle seems to have removed parasites and biofilm from him. After passing those, he's speaking more. That's awesome, Jasmine. This is what we want. These are the stories we need to share, everybody. We need to share stories of hope around the world because people need to know there's ways to help. Tina, does low-dose naltrexone be used long-term? It's been helping with awareness and speech. I don't prescribe low-dose naltrexone, so I can't make any medical determinations on that. So speak with your doctor. But I know a lot of our patients are on LDN, low-dose naltrexone. It's an anti-inflammatory. Got it. Thanks, doctor. All right. That's all our live questions for today. If you do have a live question, put it in the comments section while I give a little summary. And that summary is, we got bugs. We got bugs in our gut, on our skin. They're everywhere. We need them. They help us. They're called our probiotics. They're called our microbiome. They're on us because we walk them around the world and we feed them. Okay? The food we eat feeds them and us. That food is called a prebiotic. Okay? Now, there are good bugs and bad bugs, and there's good food and bad food. We all know what the bad food is. It's sugar, it's carbs, it's chicken nuggets. Come on, we know what the bad stuff is. It's candy, and we know what the good stuff is. That's healthy fiber, healthy protein, fruits and vegetables. Okay? The more healthy food you eat, the better probiotics you have. Period. Okay? Easier said than done, especially with our picky eater kids. So what can we do about it? Number one, start with a prebiotic supplement. Start with the right fiber to feed the right bugs. You can also take a probiotic supplement. Help some kids, not all kids. Or you can do a stool test, an advanced stool test to figure out, hey, this is probably what my kid needs. The trial and error method works. The lab test works. But let me say this. If the more severe your gut inflammation, the more severe your autism symptoms. Lots of scientific research shows that. And the worse your gut inflammation, the slower you should start to implement these therapies. Because if you just start out with a regular dose of prebiotic or regular dose of probiotic, it's probably going to work. And it's probably going to cause pain as it works. These are called die-off reactions or Herx reactions or Herxheimer reactions. All right. So if that happens, it's a good sign. It just means go slower. All right. It will work. You just got to baby step your kid into them, and that's okay. You want to baby step into the cold water? That's fine. All right. Do what works for your kids. But I need to emphasize this. Most biomedical, most vitamin supplement treatments for autism are going to work or have side effects. And whether they work or have side effects is going to be consistent. So if you take something, like our folinic acid, our Skowron solution, our Power and Focus and Calm and Cool, it's going to work or it's not going to work. Either way. When you deal with gut treatments, if you take something, you might have pain first. And so it can seem like it's getting worse, but then once you get rid of the infection, it's going to get better. So if that happens with gut treatments only, lower the dose, go slower, ease through it. Okay. One last question here. Megan says, after a stool test, my son has about half the positive microbiome. How do you diversify the probiotics? Prebiotics. Feed them the food that they want, and they shall come. If you feed it, they will come, Megan. All right. Coupon of the weekend again, Probiotic 20. It's going to get you 20% off any of our supplements, any of our lab tests, even our bundles now, our yeast mold bundle. That expires July 28th, 2024. If you want one-on-one help, like we did, Jasmine was sharing her stories about her son and what we did, go on our website, book an appointment. You can book it right there on SpectrumAwakening.com. Thank you, everybody, for listening. And frankly, thank you for doing everything you can to help your kids. We appreciate if you share this. There's too many kids around the world that need help, and there's so many ways to help them, but we need to show them that there is help. So spread the word. Love you guys for everything you do. Have a great weekend. Talk to you next week.